Hello, welcome to Posture Projects. I'm Dr. Wil here, River Valley Chiropractic. We have some patients that come in here, sometimes with pain in their hamstring, and this is due to either a strain or sometimes working out in the gym, and they'll get a little bit of a tightness in their hamstring. So we can see here over here on this chart where the hamstring is. There's basically these guys right here in the back of the thigh. You got the biceps femoris here, you got the semitendinosus, the semimembranosus here, and you can see there's bands of muscle here in the back of the thigh and where they attach and insert themselves right here into the knee. And you can see also not only into the knee, but then also into right here where the glute, the ischial tuberosity here in the glute, where the glute and hamstring meet. So, what we're going to do today is basically I want to show you for those folks who have like a mild or moderate strain in the hamstrings, either from a strain or a fall, that type of thing, or general tightness in the hamstring from working out, that type of thing. I'm going to show you how to foam roll that out. Starting with, we're going to start with the back of the knee, and then we'll do where it inserts here in the glute ham tie-in, the glute hamstring tie-in. We're gonna do a foam roll there, and then we're gonna show you how to foam roll the entire belly. So in just a few moments here, we're gonna talk about that. All right, here I am on the floor. Basically, I got my good old handy-dandy foam roller here. If you have a small foam roller, it doesn't matter what kind of foam roller you have, but any kind of foam roller will do. Basically, I have the foam roll here right at the crease of the back of my knee. So now there's a lot of business going on here in the back of the knee. You got where the calf muscle inserts to the back of the knee. You got the hamstring inserted into the back of the knee, and you have a couple little muscles, the plantaris and popliteus in the back of the knee to help unlock and lock the knee. So there's a lot of business going on in the back of the knee, and sometimes tenderness, tightness, and cramping up of those muscles can cause discomfort actually within the knee itself. So this is a great way to foam roll that. Since the hamstrings insert right here, we want to foam roll this on a regular basis to keep that area loose. Sometimes athletes will even have problems in their knee from they'll have problems with squatting and some of the movements they do at the gym simply because of tightness in the back here where the hamstring meets and where the calf meets. So by foam rolling this on a regular basis, and I usually recommend hanging out here for about 3 to 5 minutes at a time. You can kind of rotate your leg in a little bit, get that medial side, the inside part of that fossa, the popliteal fossa, or the crease in the back of the knee, and I can rotate a little bit this way to get the lateral side part of the fossa of the back of my knee, and I can even bring my leg up and out like this, kind of extending the leg a little bit, extending the toes, dorsiflexing the foot to get a little bit of stretch, kind of where that hamstring again inserts right there in that fossa on the back of the knee, that crease in the back of the knee. And I can kind of just hang out here and you just kind of hunt around and find those tender spots. I can even do a little bit of cross fiction, add a little bit of force here, downward force onto it. I can just hang out like this, back and forth, and you'll feel that tenderness, like right there. That's where I'm searching, and that's where I'm finding myself most tender, right there. And I can just hang out right there in that spot, and I can dorsiflex my foot, get a little calf stretch as it's my leg is putting pressure on that area. Again, foam roll onto that. So this is a great way, again, to loosen up where that hamstring meets the calf and where that calf meets the hamstring, causing a lot of tightness in that particular area. Again, if you have mild or moderate strain of your hamstring, as well as, you're having problems going into a deep squat, this is a great way to help alleviate that tightness in the back of the knee. In just a few moments here, I'm going to show you how to do a foam roll on the glute ham tie-in, where the hamstring meets the glute. And again, that's an area that's got a lot of business. There's a lot of muscles that insert right there and cause a lot of discomfort. So in just a few moments here, we'll talk about that. All right, so this is a continuation of, we just talked about the muscle, the hamstring muscle and where it inserts in the back of the knee. and also where the calf inserts in the back of the knee. So we kind of foam rolled some of that out. Now we're going to foam roll kind of where the hamstring meets the glute. So you're going to take the foam roll and you're going to sit on your butt bone. Right there, that ischial tuberosity. That's where the hamstring attaches to. You're going to sit on that butt bone, and you can kind of go back and forth just a little bit. Again, doing this as tolerated. You can use your hand here to apply, to put a little bit of upward force. So if it's too tender for you, you can apply a little bit of upward force here, so that way you're not fully seated onto that foam roll. And you can kind of just search around as you go backwards here. You're right on to where that hamstring meets that ischial tuberosity, or that butt bone, that bone you sit on. And you can hang out right there. Yeah, that's a really tender spot for me. And you can kind of go back and forth on that spot. Again, this is a great tool to use if you got mild or moderate strain in the hamstring from an injury. Or, you just did a little bit too much at the gym. You did a little bit too much. You did maybe some heavy deadlifts. Maybe you did some deep squats or deep air squats at the gym, and you find yourself tight in the hamstring, a little sore through there. This is a great tool to get that. So again, just back and forth. I can kind of lean to one side too. I can lean over to the left side, again supporting myself with my left hand. Boom, right here. And I can get that medial side, that inside part, kind of the inside part of where that hamstring meets that ischial tuberosity. I can go kind of in the center, and I can use both hands here to support myself. I can lean forward just a little bit. The more I lean forward, the more weight is going to be put on to that hamstring. So again, do this as tolerated. Less weight, I'm hanging back like this. More weight on it, I'm leaning forward. So again, I can lean this way and get more of the lateral part of that hamstring, that glute hamstring tie-in right there. And in just a few moments here, I'm going to show you how to foam roll the belly of the hamstring. So that way we encompass the entire hamstring. All right, this is a continuation. We just kind of talked about foam rolling the back of the knee, and we just talked about foam rolling the glute ham tie-in for the hamstring. Now we're going to talk about foam rolling the entire belly here. I usually like starting out at the crease of the back of the knee, and then adding a little bit of pressure here with my other leg. I'm basically lifting myself up here just a little bit so I can roll that sucker, roll the back of my hamstring. I don't know if you can see that there on that. I'm just lifting myself just a little bit, and I'm adding a little bit of pressure here in the back of my thigh. I'm rolling the entire length of that hamstring. And eventually I'm right back to where that glute ham tie is, right there, where we kind of showed you on the previous section. Boom. Again, I'm going to start at the fossa, popliteal fossa. Add a little bit of pressure here with the other leg, and just bring myself up just a little bit and lean forward. Boom. I'm slowly creeping forward on that hamstring. Rolling that out. I can even lean to one side a little bit. Again, you're kind of hunting around, search around for those tender spots, and if you find a tender spot, you can kind of hang out there. Kind of rock back and forth a little bit on those tender spots. And eventually, I'm kind of back where, I'm back where that glute ham tie-in is. I usually recommend starting at the fossa and working your way up toward the ischial tube, because you do have things called veins in your body, and there's one-way valves in the veins, so it's always nice to kind of push the blood flow and the circulation toward your heart. So here, and as you're doing this long foam roll here, I always recommend going toward your heart. Nice and slow. And again, if you find a tender spot, you can hang out there a little bit, kind of rock back and forth on that spot, and then slowly bring your weight up a little bit more. And pretty soon you're back at that glute ham timing right there. Lean forward. Remember, you can lean forward to get more, or you can lean back to get less pressure. Obviously, if you're more super tender in there, you can lean back. Again, this is a great tool to use if you got mild to moderate strain of the hamstring, and or you kind of overdid it at the gym, or maybe you overdid it in the yard, bending over, doing gardening, that type of thing. So again, if you have any questions about this video or any of the videos that we have, feel free to comment in the section below. If you like what you see, please hit subscribe, and that way we kind of know how you guys are feeling about these videos. Plus, it'd be a great way to segue to comment on it and let us know if you have any suggestions or anything like that and other videos you want to see. But anyway, we thank you for your time. We'll see you next time.